Hello, my name is Sylvia von Mackensen. I'm a medical psychologist working at the University Medical Center in Hamburg, Germany. And I'm very pleased to present you our results of the quality of life assessment in hemophilia B patients who have received gene therapy with Vidana Cogen Elapavovec. And I want to make a short summary why we think that these results are quite interesting. As you know, the gold standard of care for severe hemophilia B patients is prophylactic treatment. So they have to have a good venous access. They should have a continuous supply of factor concentrate and a good adherence to treatment regimen. And so the burden of the management of clinical sequelae of hemophilia has a negative impact on the health-related quality of life and the self-reported health status. And so FIDA is an AAV-based gene therapy vector transferring the high activity variant of human factor 9. And so with that, it is hoped that it is enabled an endogenous factor 9 expression. And here we present results on the quality of life of these data. So there was a phase 1/2a study where 15 patients were enrolled with moderate to severe hemophilia B. And after that study, so adult patients, and after their study, they had the chance to be enrolled in a long-term follow-up study, and they were followed up for 5 years. And several patient-reported outcomes were included in this study, like the hemophilia-specific HemEqual questionnaire assessing quality of life, and the EQ5D, which is a generic measure for assessing health status, and a self-developed instrument, ad hoc developed instrument for assessing the change in activity. And here in that long-term follow-up study, 14 patients were enrolled. 1 patient declined to participate with a mean age of 42 years. And some of the patients had target joints, and in 14% there was still HIV infection present. For the quality of life results, over time what we could find, so the HemEqual is based on that direction that a high value implies a high quality of life impairment. So when there is an increase in the scores, so that means an improvement in the quality of life of these patients. And we could find for each of the domain an increase, but for the domain dealing with hemophilia. But this is due to the fact of the items which are included in this domain. There are items concerning recognizing bleeding. And of course, if you have gene therapy, if you have undergone gene therapy and everything works well, you don't bleed any longer. And so you're not any longer so much concerned if you recognize a bleed in the right time and if you can really tell if it is a bleed or if it is a pain. And over time, over 3 years, we compared baseline data with 3 years follow-up data. We could find that for all of these domains, we found a clinical meaningful reduction, especially for the domain physical health, sport and leisure, and for the total score. Same results we could find as well for the generic EQ5D visual analog scale. Here it is the opposite way around, so a high value implies a good health status, and as well here a clinical meaningful difference was found from baseline to follow-up after 3 years. And the question concerning the self-developed questionnaire concerning change in level of activity revealed that after 3 years, none of the patients were doing less or the same amount. So the same amount of physical activity we could find, but none of the 13 participants where we had data from baseline to follow up were doing less activities than before. And concluding, we can say that health-related quality of life improvements, which we could find in this study, are a clear indicator that feeder can reduce the burden which is associated with hemophilia. And with that, I would like to thank you for your attention.